Welcome. In this video, we'll explore pancreatic cancer, a serious disease affecting the digestive system. We'll delve into its causes, how it develops, its symptoms, diagnosis, treatment, and more. Understanding this condition is crucial for early detection and improving patient outcomes. The exact causes of pancreatic cancer are complex and often involve a combination of factors. While the precise origin isn't always clear, several risk factors have been identified. These include smoking, which is a significant contributor. Obesity and a diet high in processed foods and red meat may also increase risk. Chronic pancreatitis, a long-term inflammation of the pancreas, is another established risk factor. Genetic predispositions play a role, particularly in families with a history of pancreatic cancer or certain inherited syndromes like BRCA mutations, Lynch syndrome, and Peutz-Jeghers syndrome. Finally, older age is a risk factor, with the majority of cases diagnosed in people over 65. Pancreatic cancer primarily arises from the exocrine cells, which produce enzymes necessary for digestion. The most common type, ductal adenocarcinoma, originates in the cells lining the pancreatic ducts. As these cancerous cells proliferate, they form a tumor that can obstruct the ducts, hindering the flow of digestive enzymes and bile. This obstruction leads to malabsorption of nutrients and jaundice, a yellowing of the skin and eyes. The tumor can also invade surrounding tissues and organs, such as the duodenum, stomach, and nearby blood vessels. Metastasis, the spread of cancer to distant sites like the liver, lungs, and peritoneum, occurs when cancer cells break away from the primary tumor and travel through the bloodstream or lymphatic system. This spread significantly complicates treatment and worsens the prognosis. Pancreatic cancer isn't the most common cancer, but its impact is significant due to its aggressive nature. It accounts for roughly 3% of all cancers in the United States. The incidence tends to be higher in men than women, and African Americans have a slightly higher risk compared to Caucasians. Globally, there are variations in incidence rates, potentially related to differences in diet, lifestyle, and healthcare access. Unfortunately, because early symptoms are often vague and nonspecific, pancreatic cancer is often diagnosed at a late stage, contributing to its poor survival rate. Pancreatic cancer often presents with subtle symptoms, especially in the early stages. As the tumor grows, it may cause pain in the upper abdomen that can radiate to the back. This pain may be worse at night or after eating. Jaundice, the yellowing of the skin and eyes, is a common symptom if the tumor blocks the bile duct. Unexplained weight loss and loss of appetite are also frequently reported. Other symptoms include fatigue, nausea, vomiting, changes in bowel habits, and the development of new-onset diabetes, particularly in older adults. Because many of these symptoms can be associated with other conditions, it's crucial to see a doctor for proper evaluation if you experience any persistent or concerning changes. Diagnosing pancreatic cancer typically involves a combination of imaging tests, blood tests, imaging biopsies, such as CT scans, MRI scans, and endoscopic ultrasounds (EUS), are used to visualize the pancreas and identify any tumors. Blood tests, including liver function tests and tumor marker tests like CA19-9, can provide additional clues. However, a biopsy is essential for confirming the diagnosis. This involves taking a sample of tissue from the pancreas, usually through EUS-GYN, needle aspiration or core biopsy, and examining it under a microscope to look for cancerous cells. Staging, which determines the extent of the cancer spread, is also a critical part of the diagnostic process. Pancreatic cancer is primarily classified based on the type of cells involved. The vast majority, around 90%, are adenocarcinomas arising from the exocrine cells of the pancreatic ducts. Other, less common types include neuroendocrine tumors, CPEDs, which originate from hormone-producing cells, and cystic neoplasms. The stage of the cancer is also important for classification, ranging from stage I localized to the pancreas to stage IV metastasized to distant sites. Staging considers the size of the tumor, whether it has spread to nearby lymph nodes, and whether it has spread to distant organs. This staging system guides treatment decisions and helps predict prognosis. Treatment for pancreatic cancer depends on the stage, location, and overall health of the patient. Surgery, specifically a Whipple procedure or distal pancreatectomy, is the primary treatment option for resectable tumors, meaning those that can be completely removed. However, surgery is only possible in a minority of cases. Chemotherapy using drugs like gemcitabine and platinum-based agents is often used before or after surgery, or as the primary treatment for unresectable tumors. Radiation therapy, which uses high-energy rays to kill cancer cells, may also be used in conjunction with chemotherapy. Palliative care, focusing on relieving symptoms and improving quality of life, is an important part of managing pancreatic cancer, particularly in advanced stages. Endoscopic procedures can be used to relieve jaundice or pain caused by tumor obstruction. While there's no guaranteed way to prevent pancreatic cancer, there are steps you can take to reduce your risk. The most important is to avoid smoking, maintaining a healthy weight, eating a balanced diet rich in fruits, vegetables, and whole grains, and limiting red meat and processed foods are also beneficial. Managing diabetes and avoiding excessive alcohol consumption may also lower the risk. Individuals with a family history of pancreatic cancer or certain genetic syndromes should consider genetic counseling and screening. The prognosis for pancreatic cancer is unfortunately poor compared to many other cancers, primarily due to late diagnosis and aggressive tumor biology. However, recent research and advances are offering hope. Immunotherapy, which harnesses the body's own immune system to fight cancer, is showing promise in certain subsets of patients. Targeted therapies, which target specific molecular pathways involved in cancer growth, are also being developed. Early detection strategies, such as screening high-risk individuals, are being explored. Research into novel drug combinations and personalized treatment approaches is ongoing, with the goal of improving survival rates and quality of life for patients with pancreatic cancer. Though the road is challenging, continued research offers the potential for better outcomes in the future.